Welcome everyone to the fourth webinar that we have with the associated partners from the EU CAISnet project. So I'm Erik. I am a moderator for the Discord server, and I've been helping organize these events together with Magda. And this is Tiago from Portugal and Acreditar. He will be talking about the work that they do, both in Acreditar and Barnabés, if I pronounce that correctly.
Yes, yeah.
Yes, good, good. So I'm not going to take up any more time. I'm just going to mention that we are recording this and we intend to put it up on YouTube. So yeah, look out for that as well. And I will leave the stage to Tiago.
So hello everyone. As Erik said, I'm Tiago. I'm from Portugal, and I am a childhood cancer survivor. And nowadays I'm working as a patient advocate. That is a non-profit organization and a parent organization for childhood cancer. Nowadays we work also with some young adults with cancer, and now I'm going to show you how we do this. Let me just try to share it. Okay. I hope you can see this. So we as Acreditar, we are going to have 30 years in October, so quite old. And we are facing the impacts of pediatric cancer since 1994. And when a group of parents started to get together and to help other parents that were in the hospitals, in the pediatric oncology hospitals ward, and yeah, so they started with a little volunteering, and then we grow up as an organization, as you are going to see now. So just a few statistics from Portugal about the pediatric oncology. So we have around 400 new cases a year in Portugal, as leukemia and tumors of central nervous systems are the ones with the highest incidence, and the survivorship is around 80% on the pediatric cancers, and almost on everyone, every type. And it's also the pediatric cancer is also the leading cause of non-accidental death in childhood, and everything, if everything goes right, we also have these challenges that 2/3 of the survivors have some late effects and of their cancer disease or about its treatment, but and also one third of these 2/3 have a severe sequel, as some countries in Europe as well. This is an award of the Pediatric Cancer Hospital. So basically, we work at the national level, and we promote the quality of life and of the patients, the survivors, the caregivers, and we try to give them and to be the voice of these patients, families, and survivors, and look for the defense of their rights as well. And we work with the national hospitals in Lisbon, in Coimbra, that is in center of Portugal, in Porto, that is in the north of Portugal, and in Funchal, that is in an island that you might know, that is an island from Portugal, that is Madeira, called Madeira. And we work with all of these people, so we say that we always work together, not only and always with our children, youngsters, ayahs, and parents, and also the siblings, but with everyone that is around us. And this community is what keeps us strong and keeps us looking for the future and to overcome the challenges of the pediatric and young and youth cancer. These are our values. Okay, I highlighted here the sense of community, very important. Then some support that we gave to the families in 2023. We gave support to 711 families, and from the emotional support, since the time that we met a family in the hospital, since the diagnosis until the end of the treatment, for example, in our houses that I'm going to show you later, and we have 3 houses to accommodate families in Lisbon, in Coimbra, and in Porto. These houses are located near the hospital, so that the families that are here can go to the hospital in a easily way, and to be near to the hospital is very, very important for these families. And the families that stay in these houses, or in our houses, are families that are from places far away from the hospital city. For example, in Lisbon, we have families that come from the islands, the Portuguese islands, Azores and Madeira, from the south of Portugal, and also from African countries as well. And in the other 2 regions as well, we have some people from different regions that are not they are more from the countryside, for example, and they are not located in the big cities, for example. And then we try to have a lot of meetings, not only like ludic and well-being meetings, but also meetings for sharing and also training and capacity development meetings for caregivers and also for the survivors and for the patients. And this is our new house in Lisbon. We had, you can see here, this was only our house here in Lisbon since 2003, as I think, and we had only 12 rooms and for the families, and also some common spaces like the kitchen, the parents' room, the survivors' room, the young patient's room, the children's room, so they can play together and be together. And they have 12 private rooms. They had 12 private rooms, and now we have now 32 rooms for all these families here in Lisbon. So now it's 12 plus 20 rooms, and we are going to do the reopening of the house in June, so it's close. This is the children's room. This is the kitchen. The meals room. Some bedroom. Yeah, the toilets of the bedroom. They have private toilets. The garden. Now we have a big garden as well, so the parents can be there. The IS can be there as well. And this is also some kind of support that we give, even if the family is here in the house or not. Maybe if the family is from Lisbon, they can also have this kind of support. And this support is the social worker from the hospital normally gives us the information that the family needs some kind of support, even the accommodation support. They give us this kind of information, and then we give to the families or to the young adults or the children, so to all of the patients. Since financial support, food support, there is a card that you can go to the supermarket. It's a card that is pre-charged before, and then you can go to the supermarket. Also material support, it can be like school support, but also can be like something that they need for after the treatments, for example. some other kind of material support. And also very important, we give this psychosocial support. We have it on the hospital, but we have an addition here for the families and for our patients, and also legal support. We have the help of a lawyer that is like an advisor, because we are not experts in legal things. And sometimes gives us help with some new laws that are updated from the government, for example, in the terms of the rights of the families, the rights of the parents to be with the children in the hospital, what kind of support does the government give to the families or to the young adults, for example. So we have this kind of legal support as well. This is in the hospital, one of the hospitals that we collaborate. And then our families are not only just someone that we give support to them, but they are also active with us. And a proof of this is that the chair of our organization, the committee, is made by parents, by survivors, by volunteers as well. So our committee of the organization, and also the parents that are in this chair, in this committee, and other parents are very active with us in our work that we do in our daily basis. But one example that we did was a petition, a public petition of the mourning period, so the parental grief, when the parents loses their child to cancer. Not only to cancer, because this was at a national level. So it is when a father or a mother loses their child for everything, for any kind of disease, for any kind of thing. And this was very important to do to the help of the parents that are active with us, and some of them also are with us since they lose their child as well. And so it's very important to have them and to contribute to, for example, this kind of advocacy project that we had. And in this case, the conclusion was that we made an awareness campaign with this petition, and then we went to the parliament, to the Portuguese parliament, and now the families have not 5 but 20 days to do the mourning period after their child dies, if it is cancer or not. So we had only 5 days, and now we have 20 days, and also the parents can have psychosocial support in these 20 days that they have now. So this is an example of the importance of the involvement of the parents. And then I will show you an example of the importance of the involvement in the association of the survivors. And it's here. So this is what our survivors and our patients can do with us. They can participate in the awareness-raising activities, leisure and well-being meetings, in sharing meetings, so they can be with other survivors or with other parents and just to be together in sometimes. They can participate also in research projects, and also in training and capacity building sessions, for example, for patients that are in the age that they need to choose a course for example, to when you get out of high school to go to the university, what course should I go? What should I follow in the future? What would I be? What job should I go in the future? So too many questions, and sometimes after the disease you got lost, and you don't know what to do. So we have this kind of training and capacity building sessions. And also in a very early age, you have to choose in the high school here in Portugal. You have to choose the area if you want to go to a more socio-economic area, to a more linguistic area, or to arts or to mathematics or science. So you have this kind of responsibility even in the early stage of your life. So and then we have this kind of training, so we can help this now adolescents and young adults. And sometimes now we have some kind of persons that are now looking for the first job as well that attend this kind of trainings. So this is an example of a leisure activity that we do. We do like regional and national meetings with the survivors and with the patients as well. This is the training capacity session, the last one that we did, with survivors from all over the country. And this was our last project that we did in some years ago, that the greatest objective was to empower the cancer patients and survivors, the pediatric cancer patients and survivors, in order to defend their rights, their own rights, and to advocate for their rights as well. And this begins with some focus group with health professionals, with other professionals from other areas like lawyers, psychologists, and other kind social workers as well. And they together in a focus group, they had to choose some challenges of the survivorship, and the ones that they choose are here in the left. So it was life after hospital discharge, caring for caregivers, and also the awareness in the community and the school. And then there was some groups of survivors that were working on these specific topics by themselves and in the group, and volunteering in the volunteering basis. And they tried to look for what's happening in Portugal regarding these kind of topics. And in the first one, for example, they look for the follow-up monitoring and the consultations that we have here. They found out that only in Lisbon there was one follow-up consultation for survivors, only in this city. But then in the other cities, there were some doctors that did this kind of consultation as well. But only in the Lisbon hospital was like regulated that the survivors should have a long-term follow-up consultation appointment with the doctor. Then they also saw what kind of projects at the European level were happening regarding the long-term follow-up, regarding the late effects, for example, and so they tried to make some awareness of this to our survivors and to our organization. Then the second group of caring for caregivers, they tried to implement some activities for the caregivers all over the country. And the third one, they made some games for schools, because one of the things that we do here in Acreditar is to go to schools to make some awareness sessions as well to the teachers and to the students, even if it is in a university as well. And then we have a game for children that was made with the help of these survivors that worked on this project. And also we have a quiz for adolescents, young adults, and also for companies about childhood cancer and youth cancer. And it was also with the input of the survivors that worked on this Dreaming with Survivors project. And based on this project as well, there were some survivors that worked on, as you might have heard before, the right to be forgotten law that is already implemented in Portugal as well. So the rights of a survivor to look for a loan, a credit loan, for example, and to have access to, for example, a life insurance, and to not be discriminated, not be discriminated, and not having to pay the double for the this kind of insurance, like any kind of insurance. And for I'm giving you the example of life insurance because of the credits that you may have access to ask for a loan to buy a house, for example, when you are like older, or where you are a young adult. And we make some surveys to the survivors, and they say to us, the result of this survey was that there was some survivors that had this kind of discrimination experience. They had the credit denied because of the insurance that said that they had cancer before, so they denied the cancer to this survivor, the insurance to this survivor. And also some cases of the survivors that they doubled or tripled the premium of the insurance, so they were like uh, discriminated for the second time. The first time when they had the disease, and it wasn't their fault. And now the second time when they tried to get a loan from a bank, from an insurance company, to buy a house, in order to buy a house, and now they were discriminated again. And then we tried to do a lot of awareness in newspapers, in the internet, in the social media, and some of the youngster deputies, parliament members, they started to work on this law, or a draft of the law. And we also have some help of some survivors that were close and make some awareness to these parliament members. And in the end, we had the right to be forgotten law. So now the pediatric cancer survivors have only to wait 5 years to get to this right to be forgotten law, and to have access to a loan with the same rights as a normal consumer. And for the ones that had cancer in adult age, plus 21 years old, they have to wait 10 years old. So now we are working on an advocacy as well campaign, and an awareness, because the law is implemented but is not regulated. So there are some insurances that are still reading the law and interpreting the law as they want, because there are still no agreement with the government and the insurance. So there is the law, but it's not regulated. And this was one of the great examples of the involvement of survivors, also in the project that I told you before, but here as well, in this specific advocacy project. Then we are associated partners of the EU CAIASnet project, as Erik told you before, and we have been attending some events, of course, and also the peer visits that we did last summer, I think. And yeah, so here is more the part of the scholar support that we give. We have some teachers that do kind of volunteering work and come to our houses to meet the children and to help them with certain topics, certain subjects like math or Portuguese or science, anything. And they can also do this kind of support online. And also we have the scholarships for the high school and the university, the survivors that are, and also patients that are going to the university, that are in the high school, to help them with some materials, also with the fees of the university. and we do some awareness raising activities that we also involve the survivors to come with us to give their voice and to give their testimony as well to the students of the school that we go. This is in our houses as well. And then we have the volunteering. This kind of all the volunteering can be done also for by survivors and parents to give this kind of emotional support. And they can go to the hospital, meet new families, and be together with them and like sharing a hope message. And the parents normally like a lot to be in kind of this presence of someone that has already overcome the disease. And there are also volunteers that does the volunteering help the families in the hospitals, in our houses, the teachers, as I told you, and also some people that give us help in the some logistic support or events that we have as well. Like this lady here, it's our volunteer. And in some events like this one, that is called the Acreditar Day of the family, because all the volunteers, survivors, and also families and caregivers are together and collaborators of Acreditar, and we just have fun in one day, and yeah, so we are together and we can share, we can talk to each other. So it's a good day, and it's going to be next weekend as well. So this was from the last year. And now I'm happy to listen to all of your questions, and thank you very much.
Let's see if my camera turns back on as well. There we go. Thank you, Tiago. That was really interesting. Um, I The houses that you have for the survivors, they're much nicer than my place. It's really good. It's really amazing.
Now this one is big. Now this is huge. The last
Yeah,
one,
yeah,
yeah.
yeah. Very, very clean. Yeah, very nice. So I do have some questions, and if anyone from the audience has a question as well, you can raise your hand. We can invite you to the stage, or you can use the chat. Um, but you were mentioning that there's some differences between the regions in the long-term follow-up care. Are there differences otherwise as well that affect survival rates?
No, so the survival rates, I don't think so. In regarding the childhood cancer, that's the one that we are more close to. And but for example, we know some survivors, or maybe that they are not living in the big cities like Lisbon or Porto, and that they might don't have the follow-up consultation or appointments with the doctor. So what they do is like to go to a general practitioner, general doctor, when they have something, when they so, and we always encourage because we collaborate with the main hospitals here in childhood cancer that have the childhood cancer award, and we always encourage to have a follow-up consultation. Some of them tell us that they do, some doctors do, but as far as we know now, only in the Lisbon hospital have like a regulated
Yeah,
appointments, and the survivors does. It is for survivors after the ending the treatment after 5 years. So after 5 years, they go to this consultation, and they do like a checkup, general checkup, or uh, they go to a specific consultation regarding their sequels, their late effects. Yeah. But before the 5 years, they are uh, being they are being monitored by the doctor, so
Okay.
they don't lose the monitoring, yeah, after the disease. But after 5 years is more complicated because we are more survivors now than the doctors
Yeah.
that and yeah, so
Yeah,
that's
it's a
a human
problem.
resources problem.
Yeah.
And yeah.
Yeah. Yeah, and the follow-up care is so important. Like we know this now. And getting help early is also really important. So, yeah. Um, it's difficult. We do have a question from Joanna. So what brings you the most joy within the organization?
I think for me is to being close to the families, to the children, the young adults now, and to the survivors, of course, when we do the activities with them, and to look for what are their necessities, their challenges in their daily life, because we are very close to the hospital reality, and then now we try to look for and into deep to the survivorship challenges, and for that we have to listen to the survivors and to be with them, yeah, because
Yeah.
on our daily activities we are more close to the families that are with the children and adolescents and young adults in the hospital, and then when we have to take more close attention to the survivors, and that's what I am
Mhm.
more engaged to, yeah, and what I try to do, yeah, when we do all kind of the activities. One there are more to have fun, and others to talk, to do some webinars, some seminar, or to just be in a capacity training activity, for example. Yeah,
Yeah.
just try to be with them and listen to them. Yeah.
Yeah, that's nice. And it makes such a huge difference. It's really important to have that uh, support, like really close to the people that need it. I have a question as well. You mentioned that you involved parents of children that did not make it. Do you have a lot of members, and how did you, you know, get those members to join you? Because I've found that to be difficult.
Mm-hmm. Yeah, to talk about the grief is very difficult, and to the parental mourning, and it was always a topic because, as we all know, survivorship rates uh, wasn't always like this, like 80% now for almost childhood cancers here in Portugal, and but we always have some kind of family that we know from our daily work, that we know that they lost their child, and it was always a topic that was always here in our ears to say we have to do something about this, we have to do something about this, because we have to listen to them as well, and to be with them and try to understand what are their necessities now, and yeah, and then we look for it, and we have a capacity training as well for the collaborators of Acreditar. I think it was 2 years ago, and with this capacity training with the consultancy, we and with the parents that are already active, because some of the parents that lost their child were already active in the committee of the organization, so they never lose contact and lost contact with us, and we started with them. So we started to them to try to engage with the other parents that were already also in their situation, and yeah, we had to find specific advocacy campaign for this topic because it's a really hard topic to talk about.
Yeah.
Yeah, and nowadays we have what we have now, after this achievement of the changing of the law. Nowadays, what we have is like some group of parents that lost their child that talk to each other, like a sharing group that monthly. I think it's monthly. They can go like this in a Zoom, not Discord, but in a Zoom, and they can share with your other parents that are in the same situation as them. Yeah.
Yeah. Yeah, it is important. I mean, it's important to involve cancer survivors, but also involving those that didn't make it, which is obviously difficult. So it's important to get the parents involved as well,
Mm-hmm.
so we don't just advocate for the survivors. Um, let's see, there was one more question I wrote down. You didn't bring it up specifically, but I've heard about it in previous webinars. Is there a stigma around cancer you feel in Portugal, or like the view of the general public? Do people look down on people with cancer, or
Well, what I think is that the information is there, but then the people only look through it and into it when happens something personal to them, when with their families, when there is a case, even in the adult world, in the adult cancer, and they start to well, sometimes there are some comments that say, "Oh, there is so much information that I didn't knew about it, but it was always in front of me because I already knew Acreditar, I already knew the Lisbon hospital, for example, but I didn't have the time to look for it and what do you do and what the hospital have to offer and the kind of support." So I think the information now, we have more and more information thanks to the patient organizations as well, all of them, not only us, and in the cancer area, because they do an amazing job to give the information to people in the adult world and in the young adults as well, and in children now. And I think the information is there, but people are still they don't have time. Only if something happens to them. But in the other way, I think there are some more parents that recent parents that are now in the hospital that they know now more about the cancer disease of the child, or in the first days they try to know, they try to look for every information possible. They are more curious. They try to know more in order to ask more questions to the doctors. So they are now more informed. They have more information
yeah,
in their eyes, and they now can do more questions. And maybe in the older times it was more difficult because the information was not so easy to access. And yeah, I think they keep the trust. They keep the trust in the doctors, but maybe they ask more questions about everything of the disease of their child. Yeah,
yeah, yeah, and that is important.
their children. Yeah,
Yeah, yeah,
yeah.
um, yeah, that is great. Let's see. I think we have. Oh, it's more of a comment from Quetti.
Mm-hmm.
The survivors um, of a fundraiser, they wear white shirts, and the friends of survivors wear red, and family and friends of those who didn't make it wear gold. Yeah, that is nice. Um,
Mm-hmm.
yeah. About the education that you do you also do specifically when a child gets cancer that you go to that school, to that class to talk with them specifically?
Yes,
Yes.
yeah, and we have a yeah, it's a book specifically for children, and it's the book is about the story of a little girl that returns to school after the disease and during all the process of the disease, of the treatment, and how the class room interacts with them, with her, and the teachers, and yeah, how it is. It's a story that we gave to teachers. We have also in digital formats, and for the highest or universities, for example, we have the quiz, and we do a presentation like I did here, with more what kind of support can you give, and with tips for them to to have more empathy with the colleagues, if there is a colleague that has cancer now, for example, in the classroom. Yeah, and we try every year to send an email to all schools to say there is this legislation that says that they give support for people that are ill, for people that are with a oncological disease, da 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 da. So we try to resume this, and also to give tips. We have like a short flyer for teachers, and we send this also in the beginning of the year, of the school year, not the year.
Okay.
And yeah, and we try to send this also in the 15th of February, and because it's the International Day of Childhood Cancer, and also in on September go, because it's the month for childhood cancer awareness, and we try to send this kind of awareness materials to schools, yeah, or to go there to talk uh, with them, yeah.
Yeah, yeah, that is great. It's really needed, I think, especially children. Like they probably have heard of cancer, but they probably don't know exactly, what it means. So it's really important. Um, I have some friends from Sweden, so who have actually experienced being bullied because of their chemotherapy treatment. Is that something that you've experienced as well? Like because they don't have any hair, or have you heard about that from any in Portugal?
So not very frequently, but we have some. I heard from some survivors that there was that case, and sometimes they other thing is that they lost uh, um, the year because of the treatments as well, and then it was very difficult to get back, to return to a different classroom with different people, not the friends that they had. Also, during the pandemic, for example, that there was the opportunity for everyone to have a computer and to be on Zoom, but as well as the pandemic was like stable, and everyone returned to school, the people that were in the cancer in treatment, they were the only ones with the computer in Zoom, and sometimes the schools don't have the adequate materials or computers to do a virtual classroom, for example.
Mm.
Yeah, so, and we can provide them with this, with a computer, something like this, but also we can provide a computer to the young person, and to the adolescent. But sometimes it's the school that don't have the adequate materials to do a Zoom class for
Yeah.
the for only the children, or the adolescent that is sick, and that is compromising her future or his future. Yeah, and yeah, and I think it depends on the level of education that you are. We have also some testimonies from students that were in the university that felt like a little bit lost uh, after returning to the university, because it's other kind of education, and the teachers maybe have less and less time for you individually to explain the things to you.
Yeah.
Yeah, so I think there is a lot of challenges.
Yeah, yeah, and I don't know how common it is in Sweden either. I just usually bring it up because I think it's so strange that they would bully over something like this. Um,
Mhm.
let's see, Giovanna said something. Uh, yeah. Yeah, there was a girl in Serbia that,
Serbia. Mm.
yeah, very recently. Yeah, I couldn't believe it either the first time I heard it. It's just so strange because we have the same thing in Sweden where they go to the school to educate the kids. So you would think, but apparently not. But it's still important, and that the education part happens, and I do think it makes a difference. So yeah, I don't want to get too stuck on the negatives, but yeah,
Yeah.
it does exist somewhere. Um, yeah, I don't think I have any more questions. Does anyone in the audience have any more? It doesn't look like it. Okay. Okay. Do you want to typing something? Maybe let's see if I wrote something more down. Oh, actually, are you paying for the food? Like the food and the psychosocial support and everything. Do you get any from the government, or is that Acreditar paying for it?
Yeah. So we are a non-profit organization, and the main support that we gave that we give to families is based on donations from public and from private entities, and the only support that we are having now from states is regarding our houses, accommodation houses, because as it is a support that the state cannot give, cannot offer, social support that the state cannot offer. There is a specific fee that they give to us, but there are also some bureaucratic problems as well, always as always.
Yeah.
But yeah, it's the only thing that the state gives to us. The rest is based on the donations of the community. And there is one thing that is happening right now. That is when you pay your taxes, or when you declare your taxes, there is an option that you can give 0.5 or 0.05, something like this, to a social, a non-profit organization or a social organization, and then you can choose the number of the organization. Yes, thank you, Sonia. 0.5, and now it's going to be 1%. Yeah, it's now a new law, and you can choose the organizations, and it is in this way that we get our budget to help the families and to help the survivors. Yeah, but there are still we are connect with other social organizations with other kind of disease. For example, with reduced mobility, there is a big organization as well here in Portugal, and our directors are in constant talking as well. And the conclusions that they reach is that only a very few percentage of people in Portugal do this do this kind of uh, donation to a social to a non-profit organization based on this 1%
Yeah.
that you can give, because otherwise it goes to the state and it doesn't cost you anything. So it's completely free, and we have to do more awareness about it, not only for our organization but to all social and non-profit organizations, because many people don't know about this when they declare their taxes, that they can give this little fee to the organization, and in the end it's a lot, can be a lot
Yeah.
for the organization.
Yeah.
Yeah.
Yeah. Absolutely. It adds up very quickly. I don't think we have something similar in Sweden. I do know that you can basically write off like, I don't know, €100 a year or something that you donate, so you don't have to pay taxes on it. But I haven't heard anything
Mm-hmm.
about this specifically. Yeah, and it doesn't add any taxes, so it's just free money
Mm-hmm.
for you guys, basically. Yeah,
Yeah.
yeah,
Then in the rest of the year, you can give a donation.
yeah.
And if you are a company, you don't. You can also give a donation, specific donation, and you don't pay a specific tax
Mm,
as well. But in this kind of the in this uh, period, I think it is from April to June when you have to people in Portuguese people have to persons have to declare their taxes. There is that small reference there always, but some people still don't do it. Yeah,
yeah, yeah. It's a shame, and it would help a lot. I can imagine. Um, I don't think we have any more questions. I just want to say that I mean all the work that you're doing is really amazing, and you
thank you.
mentioned like yeah, it really is. You mentioned the right to be forgotten. Not only have you managed to implement that in Portugal, but you're actually helping others implement it as well, right? In other
I hope
countries.
so.
Yeah, so you're really doing a good job. Um, it's really amazing. Um, yeah. So Tiago Costa from Acreditar.
Yes,
Um, I'm always very bad at ending the events. I need some more practice on this. But yeah, thank you so much, Tiago,
thank you.
for joining. It's been really educational. It's been great, and thank you everyone from the audience as well. Thank you, Magda.
Thank you, everyone. Thank you, Erik.
Thank you. Bye bye.